While vein disease is common, especially among seniors, it doesn't mean it's a normal part of aging. Itchy, swelling, achy legs can get worse over time, impacting mobility and quality of life. Our next guest offers a variety of treatments with no downtime or painful procedures. Dr. Tony Reincke from Reincke Vein Center shares how the modern way of addressing your veins is quick and comfortable. Good morning.
Good morning.
It seems like almost every week I have a friend who comes to me and asks me about vein disease and what do you think's happening with my legs. And I have one right now who is so hesitant because she went through it with her mother. It was the old way of doing things, which you have witnessed as well, which is what brought you into the modern way of doing things.
Yes, ma'am. 30 years ago, I was a surgical ICU nurse and worked in an open heart unit. Occasionally, we'd have that overflow of patients from previous vein stripping procedures. So they had to go through a major operation and a 6-week recovery time. Now, fast forward, it's 30 years later. I'm now a physician, and the procedures that I do are minimally invasive and have patients back to their normal activities the same day, no downtime.
I'm trying to wrap my head around 30 years ago. You were grown enough to be working in the field, but all right.
Yes, ma'am.
Vein disease, 27% of adults basically suffer from it. Impacts men as well, but women more. Do we know why?
I think that's primarily, if you take away the genetic component, it's primarily due to our hormones. So estrogen and progesterone cause a little bit more laxity in the veins. And since those are female hormones, that's why there's a little bit more predisposition for females.
Yeah. What are some of the common risk factors?
The number one is genetics. So if your mom or dad has it, you have a 50%. Both your parents, it goes all the way up to 90%. Occupation where you sit or stand a lot, obesity, as we mentioned, female hormones. Those are probably the biggest risk factors.
We're looking at the before and after pictures, and it's crazy the difference it makes, not only in you see the smoothing of the legs, that we don't see the bulging veins, but also the legs look thinner.
Yes. So because of the backward blood flow in stretched out veins, it causes fluid to leak out of the cells that should be inside the cells. So that contributes to swelling. Now, there's no magic wand here, so I certainly don't tell my patients, hey, 100% you get these veins treated and all your swelling is going to decrease. But it helps. It's going to help to decrease their swelling.
Yeah. All right, you touched on the latest procedure. Take us through exactly what happened. So they go in, there's a thin wire that's inserted. So tell us about how this works.
Okay, so after we get a diagnostic ultrasound, the patient comes in, we're gonna numb up their skin, and then I put a catheter, which is like a flexible straw, inside the vein that I'm treating that day. Lots of numbing water goes all around on the outside of that vein, and then the catheter heats and seals that vein shut. The catheter then comes outside of the body, the vein stays in, and it just scars down over time, and then your body will dissolve that vein over time. That could be a period of months to years that happens.
Yeah, we mentioned earlier that this oftentimes increases, the chances increase with age, but it doesn't mean that what you're dealing with is normal. What are some of the other symptoms that people should look out for that might point to vein disease, or at least point to them coming in to get a diagnosis?
So we talked about heaviness, aching, tiredness, especially at the end of the day. Also, leg cramps and restless legs may be symptoms associated with vein disease.
Yeah, the evaluation is so important because I also run across a lot of people who are misdiagnosed or it's mistreated when they start to see things with their veins. They're thinking this is a cosmetic issue, or when they have that heaviness that we talked about, they think it's a muscular issue and just a simple part of aging, power through. But also if they have the itchy, scaly situations and sometimes the open wound, they're thinking this is a dermatology issue, when really it's what lies beneath.
That is correct. So we'll see patients that come from other specialties or for many years have had these symptoms going on and just either misdiagnosed or underdiagnosed. And we can certainly help them with that. So working with other specialists collaboratively really certainly helps out the patient significantly.
Yeah, and that evaluation is a comprehensive ultrasound, is non-invasive. It's easy for the patient. The cost is one of the other things that keeps people away, but this one is one where you can apply certain insurances.
Correct. So if it's deemed medically necessary, we take Medicare, we take Medicaid, and we take all commercial insurance or most commercial insurance. Certainly my team can help patients with that. So if we have somebody call in, my receptionist, who's amazing, she can help patients work through that and make sure that they are indeed covered.
Yeah. The other thing that makes a lot of people comfortable is that you evaluate every patient. You do all the procedures. Patients can have your cell number for after hours, and they can work out with you an appointment if there's another time that works for them. So, you know, it's a case-by-case basis that you can stay late for them. Dr. Reincke, thank you very much.
Thank you for having me.
All right, Reincke Vein Center has a special offer. Mention Great Day Houston to receive a free consultation. Call them at 281-394-4446. Again, that number is 281-394-4446, or visit their website at reinckeVeinCenter.com.